In our previous discussion, we laid out the broad ambitions of health policy across Africa, but policy on paper often looks very different from reality on the ground. In Kenya, the shift towards a social health authority has centered national debate with over 30 million citizens now registered out of a population of over 53 million. Yet, policy ambition hits a fragmented reality. Doctor to patient ratios vary widely, often cited between 1 to 5,000 and 1 to 17,000, which likely reflects stark regional imbalances. While historical data placed insurance coverage at 25%, current SHA enrollment is definitely driving this upward. Despite this, out of pocket health spending remains high, and 2025 assessments found nearly half of public facilities lacked essential equipment. In Botswana, a country of over 2.3 million people, the healthcare system is anchored by globally recognized achievements in HIV and AIDS prevention and treatment. The government provides essential services, including maternity care, vaccinations, and ARV therapy at little to no cost to citizens. However, the system faces significant operational strain. Although the healthcare workforce saw modest growth between 2019 and 2020, with medical doctors increasing from 888 to 906 and nurses from 7,663 to 7,679. Many professionals remain heavily centralized in Gaborone. This uneven distribution leaves rural areas with low staffing and supply shortages, often leading to patients' clinic hopping in search of care. These challenges are placed alongside overcrowding, staff shortages, and service breakdowns. In the Gambia, a nation of over 2.4 million people, the 2021 National Health Insurance Act stands as a landmark attempt to shift towards universal health coverage. Under this act, the health insurance system, which has over a million enrolled, is designed to be free for designated persons, specifically children under 5, pregnant women, the elderly over 65, and the indigent. However, the system is currently navigating a difficult transition. Household out-of-pocket spending has almost tripled, historically rising from 11.5% to roughly 33.8% of total health expenditure. This financial weight leaves many in a position of profound vulnerability. These challenges, alongside others like medicine stockouts and a shortage of healthcare personnel, have created the backdrop for the health insurance system's current race to ensure that enrollment actually and truly translates into affordable care. In Seychelles, a country with over 119,000 people, the healthcare system stands as a beacon on the continent for its commitment to universal access. It is reported that the system is majority public, with 83% of doctors and dentists practicing within the state sector. While this concentration of staff is high, the country's accessibility, where approximately 75% of the population can reach a facility within 30 minutes, is largely a result of the population being heavily concentrated on the main island of Mahe. While it is reported that citizens pay nothing at the point of use in public facilities, a national health insurance fund is also in practice. However, records show a number of challenges such as limited local infrastructure, a reliance on imported medical supplies, among others. In Algeria, a nation of over 44 million people, healthcare is a vital social sector aiming for universal and free access. While the system is constitutionally free for residents, it is supported by a mix of government grants and social security contribution through the National Employee Insurance Fund and the National Non-Salaried Insurance Fund. A notable success in the system is a surge in medical personnel. The number of physicians rose to 83,713 by 2020, bringing the ratio to 190 per 100,000 inhabitants, effectively surpassing the global average of 170. However, records show significant challenges: a worrying patient per bed ratio, staff shortages, outdated equipment, and long queues, among others. These hurdles are compounded by healthcare geographical disparities, where the lack of comprehensive care in some regions forces interregional mobility. This situation is further aggravated by persistent brain drain that saw over 1,000 Algerian doctors licensed to practice in France in 2022 alone. These 5 nations serve as a microcosm of the reality of healthcare across Africa. What do you feel is the biggest hurdle to trusting your local healthcare system?